The anterior cruciate ligament is critical to the rotational stability of the knee. It's a ribbon-like ligament that runs through the middle of the knee. Hyperextension and rotational twisting mechanisms both put the ACL under strain, and when it ruptures, the torn ends of the ligament usually bleed quite a bit, so rapid and marked swelling of the knee is a common feature. Other structures in the knee can be injured at the same time, including the collateral ligaments and the meniscal cartilages, which also help stabilise the knee. Pain, instability of the knee, and rapid onset of swelling are the most common signs to raise concern. First-line investigation should involve an X-ray and MRI and referral to a physician for full assessment. Not all patients with an ACL injury require reconstructive surgery, but in patients with associated meniscal injuries or younger, active patients, or those experiencing instability episodes of the knee, surgery can restore stability and significantly improve quality of life. Here you can see an animation of a knee reconstruction a little bit faster than normal time. And there we are with the final drilling of the tunnels, the passage of the graft, and the fixation of the graft with closure. In the past, it was not thought that the ACL could heal spontaneously. But there are increasing case series of ACL ruptures that have been shown to heal with various bracing protocols or indeed spontaneously. The milestones and criteria for return to sport after an ACL injury include return of confidence, lower limb strength, particularly the hamstrings, hopping performance, and agility. We know that graft maturation takes many months. A prospective study showed that for every month that return to level 1, that is jumping, pivoting, and hard cutting sport, was delayed, ACL graft rupture risk was reduced by 53%, up until the 9-month mark, where it flattens off a little bit, but it is still very significant overall at 20%. And here you can see the marked difference in re-injury rate between those who pass the Delaware return to sport criteria and those who did not. So clearly, time alone is not enough to ensure reduced injury risk following return to level 1 sports after an ACL injury. But the study does tell us that return to sport prior to 9 months is a risk only certain individuals tend to take. Now, young women in sport are at the highest risk of ACL injury, at 4 to 6 times the risk of men. Other factors that seem to increase risk include hypermobility, a family history of ACL injury, and impaired hip and knee control on landing. Injury prevention programs have shown significant benefit in reducing risk by as much as 40% and have been implemented in a variety of sports. Common themes of these programs are that they involve a significant warm-up period before games and training, generally working with partners together, providing feedback to each other on jumping, landing, and stability exercises that are then integrated to maximise motor control and physical preparation for sport.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.